The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
And welcome to Dr. Tom Roselle Live. We are live in studio today on this great Saturday afternoon. Hopefully those of you that have joined us know that we're not on Sundays till the end of the year because of the Redskins game, but you're here to join us, and we thank you for supporting us at 4 to 5 p.m. every single Saturday through December. In studio today, I will be filling in. I'm Dr. Stephanie Pina. I'll be filling in for Dr. Roselle as he's out actually inspiring new generations of chiropractors and naturopaths and acupuncturists as we speak. But I don't have to do it alone. I get to bring in a co-host with me, and we have a great topic for you today. But first, I'm going to introduce Dr. Leonard Crow, who you know from the Roselle Center for Healing and also Core Concepts Chiropractic in the Broadlands.
Hey.
How are you doing today?
I'm great. Thanks for having me.
All right. I know you're really excited about the World Series, so you wanted to tie that in somehow. And
we can talk about that if you want.
We can talk about that? Okay. We're going to talk about how acupuncture and chiropractic and naturopathic all come together to help the World Series.
And we could talk about,
we should.
Maybe talk about sports injuries along the way, but.
Maybe we could do that too. I mean, we got plenty of athletes who are definitely, I would say with the rise of social media, certainly putting their pictures and their information out there saying, hey, these are what's keeping me going throughout the year, so why not?
Sure. If Max Scherzer's listening, then, I'll get rid of that subscapular bursitis for you and make sure it never comes back.
There you go.
I'll put a plug there, yeah.
I'll put a little needling after you're done.
There you go.
So as you can guess it, we're going to be going over some topics today, but feel free to give us a call in if you want to talk to us or have any questions. You tried and applied, as Dr. Roselle says, so if you are looking for a natural approach, we're here to answer your questions live. You can give us a call at 1-888-630-9625. Again, that's 1-888-630-9625. And today what we're going to talk about is this mesh of, I guess you could say, holistic disciplines of what we tend to see at the Roselle Center for Healing, what we do. And we see great results basically taking into the ideas of the triad of health, using that biochemical, mental, emotional, and structural balance all have to go together. And Dr. Poe and I have been working together for quite some time.
Long time now, yeah.
Probably almost 10 years,
yeah,
I would think.
Probably about 10 years now, yeah. It's been a while.
And so we've been combining this for a while. It does. You have a new practice.
Yeah.
So how we bring together chiropractic care and even the diagnostics and what we're doing with treating and other types of modalities at the Roselle Center really can be as easy or complex as you look at it, because a lot of times when we're seeing it from a practitioner standpoint, it may make more sense because we see how everything interconnects. But to the person who maybe they've never had chiropractic, maybe they've never had acupuncture, and they're suffering from something that they're saying, this isn't working anymore, really that combination really kind of hits everything. So what's your experience?
And I think people are they're a lot sicker today than what they used to be. You'll hear Dr. Roselle talk about, these chiropractic miracles, and, you'll hear guys that have been treating for a long time. It used to be easier to get people well, and people are just more sick today than what they used to be. A lot of that has to do with biochemistry and all the exposures. I mean, we live in a very chemical world now, so the inside of people is not what it used to be. So when you're trying to make structural changes or you're trying to make energetic changes, people have a lot of garbage that they're carrying around. And so you have to combine lots of different things now to really get them well. And you have to do a lot of those things in parity. And I think that's kind of the challenging piece, which is nice where we are because you can do all those things in parity. And, what I would say to people is if you've tried acupuncture and it didn't work, or you tried chiropractic and it didn't work, or you tried making nutritional changes and it didn't work, sometimes you have to do those things together, and you have to do them in certain order sometimes. And, that's the piece I think we do really well.
And I think we see that when patients come in, not only just trying them, you talk about the order, I think is really important too, because sometimes you need one to follow the other.
Yeah.
And we'll have that even when we schedule patients out, we'll have them kind of say, okay, if you see a difference between, seeing Dr. Poe and then myself, or myself and then Dr. Poe, some patients just know it.
Yeah.
Right away.
And, everybody's different, and the body will only do, what it will do. And, you got to baby step it sometimes, and, little slow pieces. But, the order sometimes matters. It makes a big difference.
And I think what's really interesting is we can kind of look at, I would say in the long time, chiropractic and acupuncture in particular, those two almost look like two different ends of the spectrum, but there are basically so many crosses in between.
Yeah.
And so many different ways that it's unreal, really. And that's why they do work as a joint team together.
Together, yeah. I mean, you can't get structural piece. You can move stuff around. I mean, that's adjusting people is the easy part of what I do. That's easy. Getting it to stay there is the hard piece. And, if they don't have the energy to hold those things, if they don't have the nutrition to hold those things, if the soft tissue is just not well supported, then people have to get treated over and over and over and over again forever, and it just never stays.
Right.
So when you do those things together, that's really where people start getting traction with things. And sometimes it doesn't matter, it can be a great adjustment. You can put the structure back perfect, but if their energetics just aren't there, if their body just doesn't have the energy to hold it, they really need to do acupuncture first. They've got to they've got to bring their energetics up a little bit for their body to start even responding to things.
Yeah, and I'll see it too where if someone comes in and say their muscles are just so tight because, they're getting off the beltway or they're super stressed, and I know they have both appointments, if I'm seeing them first, I can help to kind of physically relax those muscles, which makes the adjustment better and hold, and vice versa. If you're getting them back into that right place where they should be, it kind of helps afterwards. So it really depends on the patient.
It depends on the patient, yeah.
So, yeah. Not as easy said and done, but essentially there are some other things that kind of lead to this link together. And since chiropractic has so much to do with the nervous system, I mean, I always love looking at the Chinese medicine aspect of it because I thought 3,000 years ago they weren't necessarily thinking, oh, yes, this is the lumbar nerve that goes to, X, Y, and Z muscles.
Yeah.
But from the applied kinesiology standpoint, there's a ton of crossover.
Yeah, there is. And it's more... Now we're getting into this more 5 elements acupuncture, but it's but no, it crosses over, and it's kind of neat. And I think particularly with acupuncture, because there's so much more research going on now with it, where you're really actually starting to understand the real physical mechanics of what happens when you needle somebody, which is really cool. They're doing with some of the thermography scans and, looking at, real live blood flow and how it changes and things like there's some really cool research coming out of that, which is neat because it ties in, centuries of usage into what's really going on.
Right.
And which substantiates, everything you do well.
Mm-hmm.
Yeah.
Right. And it's well balanced.
It works, but it's, how do you explain it to somebody, what's really going on?
Right. Exactly.
And, putting it in, terms that are sometimes more palpable for people to, understand.
Well, I think when we look at the chiropractic side of that too, when people don't think about how the nervous system and the structural system around it, the spine, the vertebrae, everything else, even any of the joints, have to all interconnect together.
Yeah. And
even just seeing some of the models of the spine and kind of understand how that affects the brain-body diagram and how a nerve from your lower back can affect the digestive tract. Instead of it being a digestive issue, it could actually be coming from, say, the lower back.
Yeah, and that's something I think we do well with pairing everything together, because you have to. The problem with most medicine today is it's so compartmentalized into singular systems, and you can't just look at just the heart or just the kidney or just the spleen or just the. You have to look at the whole body together and how all these different parts are playing together and working, to really get somebody well. And I think that's the kind of the neatest thing with patients when they realize how interconnected everything is. And sometimes fix C, you got to fix A and B first, and you got to fix them together. And, that's kind of a neat thing to see.
Yeah. So we're going to talk about some of the other things. I think digestion is a great kind of starting place, and we might come back to that too, because it's not something that you think of if you're cracking someone's back, right? Oh, that's going to help out my IBS issues, my colitis issues, and that's clearly the gastroenterologist. That's clearly another realm. And, when we think about what we're doing, even where you're adjusting and where I'm putting needles in may be completely different from where that person's expecting it to happen. But it's those neurological connections.
Yeah, how does it all flow together and make it work?
Yeah. See, it's flowing like this show. So well. Yeah. So,
and if anybody wants to call in, we're happy to take calls today on, any particular problem and kind of tell you from a chiropractic perspective or from a nutritional perspective or acupuncture perspective, how do we look at that and, what would be some different things to do for that sort of thing. So. I
do think that's one of the unique things about what we do is where we do have not only the two of us, but then we also have our nutrition department that kind of comes in and says, on an everyday basis when you're not in the office, what does nutrition have to do with it? And if you need supplementation, how do we help decrease inflammation and keep the body firing the way it should in order to heal properly?
The nutrition that's such a fundamental piece for most people. And I mean, our diets are so bad here in the U.S. anyway that I'd say that's like half the battle for most people is getting the nutrition squared away, getting the right things into you that you need, and getting the garbage out of the diet. And nothing works well when you're putting garbage in there all the time. And we know what we know because we're in this bubble all the time. Mm-hmm. But, if people don't realize half the stuff that, they're consuming is just not good for you. Mm-hmm. And why it's not good for you. And that's I don't want to just tell you don't eat this, but here's why you shouldn't eat this, and here's what it does to you. And, all the additives, preservatives, all those things. Those are real. I mean, those are those things that you consume day in and day out that, that one little bit isn't going to make a difference, but that little bit every couple hours, every day, every week, it makes a difference over time.
Right. That's your new lifestyle.
Yeah.
That becomes your go-to things to do. And so when you don't know anything differently, and when you start making those changes, that becomes hard because you realize how many times you're eating a day, how many times you're maybe not drinking water a day, or replacing that with something else. And so does that have effect on how our tissues and our muscles and everything fires because they're not getting what they need in order to be proper and function proper as well?
Yeah, and I think, people ask, well, what are you selling? It's like, it's lifestyle change, really. I mean, that's the big thing. It's lifestyle change. We'll get you going in the right direction with all these different things that we do, but at the end of the day, it's got to have a lifestyle change. You have to shift things. Yeah, you have to be more active. You have to eat right. You got to drink more water. You got to, or else, put my kids through college, right. Because you'll never really get better. But if you change all those things, then you will. Your body will respond. It'll heal.
Yeah. And so whether those tools of the trade are your hands to adjust or any of the physical therapies or Chinese herbs or nutrition or something like that, really it's putting it in there and letting the person also improve their own healing response.
And figuring out what they really need.
Right.
What's the piece that you really need? Right. I mean, everybody's different.
And that's the ultimate goal of kind of looking at what holistic healing is kind of doing, looking at the whole body from top to bottom, inside out, and really kind of pushing us in the right direction to make those changes last a lot longer. Not only prevent disease and illness, but also kind of treat it at the acute stages.
Yep.
So we don't see that in conventional medicine as long.
No.
You're listening to Dr. Tom Roselle Live. We are going to take a quick break, and we're going to be back. You're listening to Dr. Stephanie Pina and Leonard Poe here on WMAL. We'll be back soon. And welcome back to the Dr. Tom Roselle Live show. We are live in studio. I am Dr. Stephanie Pina, licensed acupuncturist and naturopathic physician, and I am with Dr. Leonard Poe, a chiropractic and also applied kinesiologist. And we are talking about that connection between chiropractic and acupuncture, how it really benefits the patients that not only we see in the practice, but it may be beneficial for you. And happy to take any calls that you might have. Just call us into the studio on this beautiful September. No, we're in October.
We're October.
Going backwards. October day. And, a lot of the times we have to think about the things, if someone was just thinking about chiropractic and acupuncture, the thing that they wouldn't think about that we started with earlier was digestion.
No.
And issues that, we see people coming in with that they have questions on. They'll come in for something else, but digestion is really the key because, if it's not absorbing those nutrients, what's going on with the rest of the body? At least there's so many other issues. So why do you think one, digestion either gets overlooked and we see patients with that, and then we'll get into also like how we kind of approach it from our aspects?
So digestion is like a lot of things where medically we tend to look at it as like a pass-fail. Either you have some sort of bowel disease. You have Crohn's, or you have ulcerative colitis, you have something like this, or you're fine. You're not dying, so you're okay. So many things are a pass-fail. But a lot of people do have poor digestion. They don't digest well. They don't absorb the nutrients well. Maybe they have some dysbiosis, some bowel flora that shouldn't be in there. They have parasites. They have fungus. We see lots of mold and fungus here in this area. People have all these sorts of things, and that hinders their ability to get well, even if we're talking about low back pain, because you can't get rid of. You're not going to stabilize the joint structure if you're not getting the nutrients you need to do that. You're not going to get rid of the inflammation if your gut's constantly inflamed, because either you got pathogens in there, or you're eating junk that you're, sensitive to, or you're, creating different kinds of inflammatory chemicals in there all the time. So you have to solve that problem along the way to help the patient get rid of, low back pain or headaches or, fatigue or whatever they're coming in for. It's a big, important piece.
Right. And from an acupuncture standpoint, what's interesting is the digestive tract is really what we would think makes our blood and our energy. We would talk about that like ATP and blood being what's circulating in the vessels from a conventional standpoint, but it's what makes us function. And so if we don't bring in the ingredients we need to make the final product of energy, and then it's not going to flow well either. So it makes a huge part of it. And then there's also the part that we don't think about. We've talked about in different shows, like the microbiomes and how good bacteria are affecting us and how not. Well, in Chinese medicine, there's a whole other aspect of Oriental medicine, food-based stuff, where we're looking at the fermented products, and we're looking at how does our eating times affect what we're doing. If you're eating too late at night and things are sitting there, is that going to lead to gastric reflux?
Yeah.
Or is it going to lead to fatigue if you're doing, heavy lunches in the middle of the day, and all of a sudden you're breaking down? And what does that lead to? So, the digestive tract can be looked at, and when we combine the types of therapies and stuff that we need to do from both aspects of it, you're really strengthening it from a lot of different ways, from the nervous system component and from the blood supply component.
Yeah. And what would a chiropractic adjustment, what would moving the spine have to do with fixing the gut? Well, your gut's controlled by the nervous system. And if you've got cranial bones out of place, if, the vagus nerve is being impeded, which is one of your nerves that come off the brainstem that directs a lot of just basic digestive function, or the sacral nerves, which counterbalance that vagus nerve, if they're being impeded in any way, if they're being pinched in any way, then the gut's not going to work the way it's supposed to work, just like your leg's not going to work the way it's supposed to work if your sciatic nerve's being pinched. Those structural pieces do change your physiology. I mean, that's how things get directed.
Right. And if we even look at it from a stress standpoint, if we're under that sympathetic fight, flight, control, we're on all the time, that is certainly not the time to start breaking down food. It's just not in our nature to do that.
And the adjustment will, when you get adjusted, you actually lower cortisol levels, which helps you digest better.
And if anyone has ever gotten acupuncture, you know that one of the biggest things that people do is they end up falling asleep right about that same time too. So they end up getting their parasympathetic can kick in, and they get their endorphins released as well. We're going to go to the break. When we get back, we're going to go to the phones. We've got a question waiting for us to caller. Please hold on, and we will be right back. You're listening to Dr. Tom Roselle Live with Dr. Leonard Poe from Roselle Center for Healing and Core Concepts Chiropractic in the Broadlands, and myself, Dr. Stephanie Pina, Acupuncturist at the Roselle Center for Healing. We'll be back in just a moment.
Dr. Tom Roselle Live continues now on 105.9 FM, WMAL.
And welcome back to Dr. Tom Roselle Live. We are in studio taking your questions and talking about how do you combine chiropractic care and acupuncture care together to really optimize your own health. And when is it important to think about this, that maybe one way is not the best way, but the combination is, just like looking at health from a holistic standpoint of how one part of the body affects another part of the body instead of just as individual pieces. Live in studio today, I have Dr. Leonard Poe from a long time. We've known each other at the Roselle Center for Healing, and then also at his office at Core Concept Chiropractic out in the Broadlands. We're going to talk about a chance to come meet him in person as well. Lucky everybody. In just a little bit, but we're going to go to the phones first. Caller, thank you for holding on to us. I know you called right before. How can we help you?
Hi, Dr. Pina. This is Charlotte. I woke up Thursday, and I was dizzy. I mean, I had to hold on to things to be able to get up and to move around. And I just didn't want to move my head because I felt that I was going to throw up or that I would fall. And the feeling is still, it's not as intense, but it's if I move my head real quick or try to get up and down, I feel like it's going to bring on the same thing. Is that an inner ear type thing, or is it something else?
Dr. Poe?
Well, Charlotte, what I would suggest, if this is the Charlotte that I think and know and love, we can do something called a Hall Pike maneuver, and it's a therapy maneuver that'll tell you if it's true vertigo, if the crystal's floating around the inner ear. It's pretty easy to do, and that'll distinguish it pretty fast. If that doesn't show up, then you want to look at other things. Is it a blood pressure issue, something like that? But that's pretty easy to be able to differentiate.
So what do I do to sort of keep myself on an even keel until I can get into the office?
I would say one of the things is definitely making sure that, like you mentioned, there was nausea related to it. Obviously, you want to keep blood sugar levels up, so keeping foods just as simple as possible, and also keeping hydrated too. I know this type of year, with the weather changes and molds being high too, there's phlegm and congestion that can build up in the sinus cavities in the head, and that can also throw off our balance as well. A lot of times there are people coming in with some of these same kind of balance issues and also changes in hearing as well too. So I would definitely keep food simple, keep hydrated.
And I would recommend just to be on the safe side, you can go down to the local pharmacy and just, check your blood pressure, just make sure it looks okay, the pulse looks okay. There's not any kind of...
I checked it at home and it was 130 over 70.
And is that your normal blood pressure?
It's in that, I'm usually, sometimes it may be, low 60s over 170. I mean, over 130.
Okay. So sometimes I'll always make sure that if definitely someone is different, their blood pressure is different from what they normally are saying, that looks a little bit more suspicious as one of those blood pressure issues that might be kind of creating it. And if it raises or drops too quickly, that can create some of that dizziness as well too. So, it would be great too to basically have more information on there that we can follow up with too. And I know you're going to be coming into the office soon, but you can always give us an email too, and to either Dr. Poe or myself, and then we can kind of take it from there. But thank you for the call, and hopefully we'll be able to kind of look at some of the other surrounding factors, from both sides of the story, the chiropractic and acupuncture. I know right now I'm treating a lot of patients that have are coming in with like this mold, seasonal changes, because or at least around here it drops so quickly temperature wise that it's catching up with people, so they're getting sinus pressure condition, very allergy like when it's not quite the season for it.
Lots of molds,
Yeah, but that brings up something that is a very kind of interesting issue as far as the bones in the head. We think of just one big bone, right? But there's not just one big bone. No.
No, your skull is made up of lots of different bones, and they're suture joints. They're joints. They move. They move with respiration as what's called cerebral spinal fluid and blood go in and out of the skull. I mean, they move.
So when you have someone that comes in that may have either whether it's sinus pressure, headaches, even traumatic injury type of stuff from sports injuries and stuff.
Yeah, concussion, and we see a lot of that out in Ashburn. Just we should have talked about youth athletics, and we could have tied that into the World Series, but because it's so much more competitive than what it used to be, and we see a lot of concussions with these younger kids, and we're just much more aware of them. And doing cranial adjusting and making sure those bones, and it's not like the kind of adjustment that you think of when you see someone get their neck adjustment. It's very gentle. You're very gently moving those bones back and forth with what should be normal cranial respiration, and you can get that sinus pressure to drain right out. It's awesome. It's immediate relief. Patients will feel that drainage happening right away, which is great when it's the barometric pressure is just cranking up, and so is the pressure in your sinuses.
Yeah, and we look at as a phlegm kind of congestion, whether it's thick or thin in acupuncture standpoints, as far as it can't move anywhere. It's kind of stuck there.
Yeah,
and
it's got to go somewhere.
Some of the points that you want to do is I call it the Whiskers Technique, because they're right next to the nose, and it's literally like opening the floodgates. And it's one of those points that never lets me down, really. And you're also opening up the lymphatics to get any of that waste material that's the body's trying to get rid of away from the head, because it's got a lot of little nicks and crannies and stuff to go to.
And it's so neat to see, with different patients who responds to that better, or who responds to cranial adjusting better, or who responds to, different, nutritional supplements to bring down the inflammation. It's kind of neat to see with people, what works for them, because everybody's a little bit different.
Right. Yeah, if you can't change the outside environment, just like if we have people coming in for stress release and they're holding it in their muscles and in their joints and stuff too, they might feel better from something like a massage therapy, but it may not hold because there could be a structural issue.
Yeah.
You
got to change you. You can't change.
Right.
You can't change what's going on outside. You got to change what's going on inside you.
Right. It's a team game, like really in the long run. We're just here to support the overall system. So, but yeah. So we're live here in studio. This is Dr. Tom Roselle live show. And if you have any questions, just like Charlotte, you can always give us a call here at 1-888-630-9625. Again, that's 1-888-630-9625. Let's talk about another kind of combination issue, one that I think we kind of see. Well, you brought up sports injuries. What about like the overuse kind of compensation issues? The person who's at work too long and sits sitting in a chair all the time and is starting to get, or is typing away at the computer and they're starting to get carpal tunnel or too much, golfer's elbow, or, all the fun stuff that goes along with that. Basically, it's that overuse injuries that we see very often in the office. Yeah.
You see it a lot, and from either, you don't have to be an athlete to get those. You can just be sitting at your desk for 8 hours a day and
the work athlete.
And get the work athlete. And, sitting's the new smoking. I think you're far more likely to die from heart attack or stroke if you sit for 8 hours a day than a construction worker that smokes a pack a day. It's terrible for you. But we see a lot of repetitive stress injuries, either from sports or from just sitting all day long. It's a slow, those sports injuries are a lot easier, the mechanisms, because you know what happened. I got knocked down, I got hit with a ball, something happened. The injuries, those slow postural changes that people get over time, it's hard to go back and pinpoint any one thing, because it isn't any one thing. It's just, you're sitting at a desk for 8 hours a day for 20 years. The funny thing, it's not funny, but the interesting thing I should say is that we're seeing those changes in younger people now, more and more. You see postural changes in 15-year-olds that, we used to see in 45-year-olds, because, when you and I were little, we didn't have phones. We had phones on the wall in the kitchen, but didn't have cell phones, didn't have, computers, we weren't on tablets all the time and stuff like that. But our kids are. They're on those things, from the very beginning. My 8-year-old uses a Chromebook at school. The kids are on the technology all the time. So we're seeing the postural changes in them much earlier on than, what we used to see in adults. And, being in front of, talking about sucking the energetics out of you. I mean, being in front of computers all day long, it's not good for you.
Yeah, I talked about, in some ways, when we talked about fatigue earlier, just being in that position with not getting blood flowing through the body. I mean, when we talked about the whole water break and just getting up and moving, I mean, it's amazing just to get up and do something. Yeah. I mean, we used to see way back in the day on the long airplane rides, right? You'd have the video that said, okay, get up and start moving. And now you don't even see that because there's more video gaming and stuff going on, and you can watch the movies all the way through. But, I mean, little things like that where we're stuck in one position. So a lot of these, like, wrist injuries and elbow injuries and just not getting blood to the lower half of the body.
People aren't moving. We're not moving like we used to.
So
that's an important piece. I mean, moving is just as vital as eating or sleeping or going to the bathroom. Like, we're supposed to move every day. We're supposed to be active, and people aren't.
Yeah,
that's a problem.
We're gonna go to the phone now. Caller, how can we help you?
Yes. The question I have, I used to have I have sometimes when I eat food, I have about the digestive system. When I eat certain food, it's giving me like bloating, but I'm trying to avoid those type of food. And the bloating system is the bloating is like a slowdown. But when I go to the toilet, and after I done, like my weight sometimes 80. After I done, when I wipe, and sometimes the stool doesn't have any blood, but when I wipe, I blood.
Okay. All right. So what I'm going to do is just kind of review what you just said. So sounds like you're kind of watching what you're kind of eating, but digestive system-wise, there's bloating and stuff that's happening. Still watching what you're eating, but then especially when you're going to have a bowel movement, even though you're not seeing anything or any blood on there, it almost feels like hemorrhoids, and kind of wondering the inflammation that's still kind of tracked there as well too. So definitely bring this back to the digestive tract. Dr. Poe, when we have issues like this, it's very interesting because we're going back to that lower part of the body, that lower back, and how the nervous system feeds in there. But also we have to work on inflammation within the digestive tract.
Yeah.
Where would you say the first places that we go with this?
If the bloating is right as soon as you eat, then it's probably low hydrochloric acid in the stomach. You're probably not digesting your proteins very well, so they're sitting there. If it's a little bit after, 20, 30 minutes later on, then it's probably more gallbladder. And I see a lot, we see a lot of that anyway. But people's gallbladders don't work as well as they really should, and you don't absorb your fat-soluble vitamins very well. You got to get those bile salts out. Or it's a mix of both of those things kind of together, and that's probably where a lot of the bloating's coming from. On the other end, there's probably a good bit of dysbiosis there, and maybe, sounds almost like maybe a fungal infection. Who knows? Those things you can figure out, though, for sure.
And sometimes, I think it's great that you're already starting to think about what foods may or may not be triggering this, because there can be groups of foods that are too acidic, too hot, essentially, or spicy for the system, that don't sit well, or you have a sensitivity to, that simply removing some of those and taking them out of the play can affect what's going on further downstream. It
can be a sensitivity issue. It can be a poor digestive issue. It can be a pathogen issue, like things like SIBO, which is small intestine bacterial overgrowth. It can be any of those things. I'm a big labs guy. I like objectable kind of data. A problem like that, doing a stool test and looking at the digestive enzymes, looking at the pathology or the pathogens that are there, and seeing the mix of it, what's there in the digestive tract, what's going on, that'll give you some really good answers quickly.
Yeah, and if someone was, say, looking if it was a hemorrhoid issue, that's also going to look to see if there's any blood and bleeding there as well too. So,
or a lesion in the upper GI tract, you'll see occult blood, and then you can take the appropriate steps.
Yeah, so it's a great question. Thank you for calling in. Hopefully, if you hear anything that we can help you with too, you'll give us a call over at the Roselle Center for Healing, or even just log into the email and get a hold of us that way at rosellecare.com. So that's www.rosellecare.com. Dr. Poe and I are both there, so we can definitely follow up with this question, just like we will always have. We often see many of the callers that we talk to on the radio station either showing up to the lectures, or we're following up with them on email, or they're actually coming in as patients, and we're able to kind of discuss this a little bit more. So it's a lot of times it's not the ends of the mean when we have to say goodbye here. So literally, but
no, if you have problems, if you have concerns, I love sitting down with patients and figuring out what's wrong. What's going on. There's so many different things to look at. There's so many different pieces. And just being a good advocate from the beginning and figuring out, okay, well, these are all your signs and symptoms. This is how long it's been going on for. Here's your whole story. What do we need to look at? What do we need to check, and figuring out what it is. And that's kind of the fun piece, I think.
Right. And I think both chiropractic and acupuncture, they're holistic system based, where they're looking at the whole body. What's great is a lot of it is based off for observation. It's really looking at the functionality. So some of the testing and stuff that we do, even the hands-on testing that you're doing with applied kinesiology, is giving you so much more information than just what at the level that you're adjusting.
Yeah. Oh, yeah. Absolutely. Absolutely.
Just like when I needle somebody, it may not necessarily be just for that point. Like I can needle somebody's knee, and it may be for elbow pain, or maybe for gallbladder pain, or maybe for a headache. So you have to kind of come up with a treatment plan that works for individually for that person, instead of just, you should respond like everybody else.
Right.
So yeah. Great call. We're going to go to the phones very quickly. We're going to try to get you in before the next break, but how can we help you?
Hello?
Hello, can you hear us?
Yes, I'm calling. I'd like you to discuss what would be helpful to, in my case, I'm a long-term tick bacterial infection patient, non-responsive to many and multiple antibiotic treatments. I finally stopped them when the only thing the MDs were recommending were intravenous IVs, which I refused to do. and just find out from your perspective what would be beneficial.
Well, so if we're talking about either Lyme disease or some of the co-infections, Babesia, Bartonella, Ehrlichia, that sort of thing. So this is where I definitely sit down with patients, and I'm patient advocate first. Okay, here's the deal, here's everything, and this is usually like a 45-minute to an hour consultation. The problem with these kind of bacterial infections is that they don't act like typical bacteria. They act like viruses a lot of times. They're very opportunistic. They're very, very, very difficult to deal with. And the reality is that nobody out there knows, hey, if you do this, you will get well. We're not even sure if you can get rid of these things 100%. There's debate back and forth on it, okay? So you have to be willing to try multiple different types of treatment. And, people tend to think that the antibiotic therapy is going to be, the best way to treat it. For some patients, it works. For some patients, it doesn't work. And there's, lots of homeopathic treatments. There's herbal treatments. There's Cowden protocol. There's Byron White protocol. There's lots of different protocols out there. You've got to really go through all those different things and see, okay, where are you in this whole skew of things? What systems does the tick-borne infection seem like it's infecting, and which one of these treatments might work well? And then you have to go back every so often and see, am I improving or am I not? And we'll come back, we'll talk about it a little bit more.
Right. And we know that is not going to be a quick fix as well, too. And that's why there's not a quick answer to it, even over the phone.
It's a complicated answer. We'll talk about it.
Yeah. We'll talk about it when we get back in just a moment. It's a great question. Thank you for calling in, Tess. We'll be back in just a couple of moments on the Dr. Tom Roselle Live Show.
Washington's Mall, 105.9 FM, WMAL.
And welcome back to Dr. Tom Roselle Live. We are live in studio. Dr. Leonard Poe, chiropractor, Doctor of Chiropractic, and myself, Stephanie Pina, naturopathic physician and acupuncturist. And we were just leaving off giving information on a caller who called in and talked a little bit about tick-borne illnesses and antibiotics that aren't being able to treat. And we wanted to just kind of finish and follow up with that because it is a very complex situation, and we get complex patients like this, and it may not be completely like this, but you have to look at it from multiple perspectives and kind of plan out on an individual basis what types of therapies are really going to work, including what we know that didn't work already.
Yeah, and what changes, because the problem with the tick-borne illnesses is that they mutate, they change. So the treatment you start with is usually not the treatment you end with. You have to go through different types because you have different variations of that bacteria. It's a difficult thing to treat, and really, if that caller would like, please come in, let's sit down, let's talk about it, so you can really understand all the different types of treatment that are out there. It's difficult. I mean, I see so many cases of Lyme in Loudoun County. I'd be more surprised if I didn't have Lyme than if I did have Lyme. Lots of people have it. They don't know it because it does get in and it stays dormant for a long time. It's opportunistic. And then your stress levels get out of control. Your nutrition gets out of control. Your immune system starts to tank off, and that's when it comes out, like Epstein-Barr or, when chickenpox, you have that and it becomes shingles later on. It's difficult.
Yeah,
it's difficult.
And we've seen this also during treatment because it's difficult then because when we are treating patients, we have to keep continually changing that treatment up because they keep having things that, this used to happen back to me, it happened to me when I was, 10, 15, 20, whether that's physical stuff, emotional stuff, it all starts to come up too because, in Chinese medicine, I think it's interesting that something like Lyme is seen what they call a goo syndrome.
Yeah.
And it was almost like this invasion of a parasite that could affect you from a digestive standpoint, a musculoskeletal standpoint, and mental emotional. And really, this is just one of the modern approaches of it. So it is a very difficult thing. I do want to recommend that anyone, if you hear any information either today or on any of the other shows, but especially this caller, if you wanted to get a hold of us, you can always go to the Roselle Care website, ROSELLECARE.com. Go to the contacts, and there's a form that you can actually email to us. And you can even mention Dr. Poe in my radio show today. And we're going to get back to you right away and kind of figuring out a way to kind of sit down and get more information, because everyone who has questions, whether it's related to this or anything else, really deserves to get the answers that they need or look at different options. One of the things that we want to talk about real quick before the end of the show is Dr. Poe has an upcoming in-house educational lecture.
I do.
You do.
November 15th, middle of the day, I believe we're going to do it again. This is one we did just a couple weeks ago and had a lot of interest in it, and we're going to repeat it. But it's, the effects of, cell phones and tablets and computers that we're seeing on young people. Not just the structural pieces that we are seeing, the structural changes, but also how it's affecting them mental, emotionally, what it's doing to different neurotransmitters. There's lots of different pieces. We're seeing, early eye problems because of the blue light. There's lots of different facets of that. So, what can you do to help with that, and what can you do to change that a little bit, and just understanding how it might be affecting your child.
Right. And I'm assuming all the different pieces too, the fact that you do have to look at children and young adults.
Yeah.
Similar, but then also there's many differences as well.
It seems ridiculous. In a lot of ways, why would I have to treat an 8-year-old for, this sort of thing? Because they're doing now what you were doing, in your 40s.
Right.
It's different.
Absolutely.
Yeah.
Well, we came to the end of the show, and the good thing is that Dr. Roselle is going to be back next week, and he, I believe, is going to have another guest presentation going on here to talk about another in-house lecture. I want to thank Dr. Leonard Poe for filling in with me, coming in when the World Series is, just getting ready to ramp up. I know he's eagerly awaiting that one after going to some of the Nats games.
That's right, the Nats.
Earlier. And I want to thank you very much. We'll talk to you next week.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.